Hello, my name is Blair Mayu, and this is my presentation, Developmental Surveillance of the 9-Month-Old Infant. So the infant by 9 months old should reach multiple developmental milestones that help them build skills to increase their independence and autonomy from their caregivers. These milestones are observed both in the office and by the caregiver in their behavior, communication, and motor skills. As the infant develops normally, they should progress steadily and in stages. In the next 4 slides, I'm going to explain the major developmental milestones that include the following categories: social emotional, language and communication, cognitive, and gross and fine motor skills. Social emotional. So by 9 months, they should be showing signs of awareness and fear of people that they are not familiar with. They should respond by looking when their name is called, and they should have increased their number of facial expressions to not only happy or sad, but also surprised. For language and communication milestones, at 9 months, the provider should be observing and or asking the parents if the infants make sounds like mama, mama, and ba, 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 or if they are ever lifting their arms, a means of communicating that they want to be picked up by the caregivers. Cognitive milestones we ask about are if the infant closes their mouth during feeding when they are no longer hungry, or if they try to look for an object that went out of their field of vision, and if they bang 2 objects together. Motor milestones. At 9 months, the infant should be able to sit without support, rake food into their hand, and move an object from one hand over to another hand. So how do we screen at the 9-month-old visit? Screening tools utilized for the 9-month-old well visit are the Ages and Stages Questionnaire 3, otherwise known as ASQ3, Parents' Evaluation of Developmental Status, and PEDS, and the Survey of Well-Being of Children, or the SWIC. The ASQ3 is for ages 2 to 60 months and is parent-completed questionnaire with a series of 21 questions that takes about 10 to 15 minutes. The PEDS form is a single response form used for all ages. It is a 10-item questionnaire filled out by parents and takes about 2 to 5 minutes. And the SWIC is a 10-item parent questionnaire and can be used in 1 to 65-month-olds and takes about 5 minutes. So child development theory. Major theorist Jean Piaget believed that a human's development comes prior to learning and through progressive sequence of stages as they grow older. Applicable to the 9-month-old development is Piaget's stage of sensory motor, which is from birth to 2 years as the infant learns through their senses of sight, touch, and sound within their environment. A substage in the sensor motor stage that also applies to the developing 9-month-old is called substage 4. Substage 4 is when the infant is between 8 and 12 months of age. And during this time, the sensory motor development has helped the child learn cause and effect, and they begin to anticipate and plan for events. For example, looking for the toy that went out of their field of vision. Delayed development. The Center for Disease Control and Prevention suggests that parents know their children best and that providers can help them understand the early danger signs of developmental delays. The 9-month-old well visit should implement a strength-based approach that includes health supervision, screenings, anticipatory guidance, as well as placing the parent's concerns as a priority. Early warning signs include the infant has not reached 1 or more milestones, or that they have lost a skill they once had, and parental concerns. Anticipatory guidance. Anticipatory guidance topics discussed with caregivers help them understand what to expect as the child grows and how to keep them safe and healthy. The 9-month-old well visit is family-centered, and it should focus on parents concerned within the following topics: social determinants of health, infants' behavior and development, discipline, nutrition and feeding, and safety. Some examples include family support, avoiding screen time, positive reinforcement, transitioning to solid foods and continuing to breastfeed, and keeping the child in a rear-facing car seat until 2 years old and never in the front seat of a car. And here are my references. And I want to thank you for checking out my presentation on the 9-month-old well visit for developmental surveillance. Have a great day.